to light the way. Making nursing stupid simple every
Before a nurse assesses anything, the heart, the lungs, the abdomen, there are 4 steps that guide every single physical assessment. These 4 steps are the foundation of everything you will do at the bedside. They are inspection, palpation, percussion, and auscultation. Let's break each one down. The first step is inspection. Inspection is simply looking. Before you touch the patient, you observe. You use your eyes to examine the body for anything that looks out of the ordinary. You are looking for symmetry. Does one side match the other? You are looking at skin color, swelling, shape, and size. You are checking for anything that appears abnormal. Good inspection requires good lighting, multiple angles, and your full attention. Never rush this step. What you see before you touch can tell you a lot. The second step is palpation. Palpation is using your hands to feel. Once you have observed the patient, you use touch to gather more information. There are 2 types of palpation. Light palpation is used first. You press gently to assess the surface, check for tenderness, and make the patient comfortable. Deep palpation comes second. You press more firmly to feel for organs, masses, or deeper abnormalities. Always watch the patient's face during palpation. Their expression will tell you if something hurts, even before they say a word. The third step is percussion. Percussion means tapping. You tap on the body's surface to assess what lies underneath based on the sound it produces. Percussion helps you figure out what's underneath the surface. Air sounds different than fluid, and fluid sounds different than solid organs. That information alone can tell you a lot about what is going on inside the body. Before we continue, there is one important NCLEX exception you need to know. For most body systems, the order is inspection, palpation, percussion, then auscultation. But for the abdomen, the order changes. For the abdomen, the correct order is inspection, auscultation, percussion, then palpation. Why? Because palpation stimulates the bowel. If you palpate before you listen, you can change the bowel sounds and get an inaccurate result. Always auscultate the abdomen before you touch it. Write that down. That one comes up on the NCLEX. The fourth step is auscultation. Auscultation means listening with a stethoscope. This is where you tune into the sounds the body is making on the inside. You will use auscultation to assess heart sounds, lung sounds, and bowel sounds. Each of these tells you something important about how that system is functioning. For auscultation to be effective, you need a quiet environment, direct skin contact with the stethoscope, and patience. Do not rush through this step. That is your foundation. 4 steps. Every assessment, every time. Inspection, look. Palpation, feel. Percussion, tap. Auscultation, listen. If you can remember those 4 words, you are already ahead of a lot of nursing students. Let's think like a nurse.
Hey, real quick before you leave. If this lesson helped you, give it a like, drop a comment, and subscribe to No BS Nursing. Don't forget to hit the bell so YouTube actually tells you when I post something. And if you want worksheets, case studies, cram sheets, NCLEX questions, and bonus content, head over to my Patreon. The link is in the description below. Thanks for hanging out with me, and remember, nursing doesn't have to be complicated. We're making it stupid simple.